April's Oral Cancer Screening or Awareness Month, and we screened over 115 people in 1 month that did a special adjunctive light that we use, which is called the Velscope. It's a bluish light that helps us look deeper into the tissues of the mouth and look for pre-growths or precancerous growths. I would suggest that it's something that you would have along with your dental cleaning. At least here, I can't answer for anybody else, but yes, it should be a part of your routine screening. When you go to the dentist, you're looking at your teeth for decay, you're looking for gum disease, or we're checking your blood pressure, all these kind of things, and one of those normal screenings ought to be looking for abnormalities in the mouth, which could be oral cancers. The face of oral cancer used to be a male 40 years and older, and it used to be somebody who drank alcohol and somebody who used tobacco quite a bit. It used to be 6 to 1 men to women. However, now it's changed drastically, and it's changed to 2 to 1, 2 men for every woman. If you look at those kind of possible causes from decades ago, you wouldn't really think about children that much. But now we're seeing a shift, the whole 2 to 1 issue, because of the acceptance of tobacco use amongst women in the last decades. But that's not all of it. What it comes down to is there's a newly identified cause for oral cancers, and that's the human papillomavirus. So that's a virus that's been associated with cervical cancers in women. Well, it's now been associated and been part of the cause of oral cancers. Has nothing to do with alcohol, nothing to do with tobacco. So the human papillomavirus, namely the number 16, is spread by sexual matters, and we will all be exposed to it at some point, or some strain of it at some point in our lifetime. So you start seeing people having oral cancer that didn't have any other kinds of risk factors like alcohol or tobacco or being a male over 40. Well, I think the news about oral cancer in 2015 is lack of public awareness. That seems to be a large part of where we're missing in oral cancer screenings and the death rates. So this year alone, there'll be 50,000 people diagnosed newly with oral cancer. There will be 8,000 who will die this year from oral cancer. The survival rate for oral cancer has changed ever so slightly, almost negligible according to the Oral Cancer Foundation in the last several decades. If you were to look and look regularly and find it early, cure rate's up to upwards of 90%. However, if you find it when it's too late, then the cure rate is extremely low, and in 5 years, more than half of the people will have died. Being aware of the facts and knowing that this is something you should get checked for regularly, meaning every 6 months to a year when you visit your dental professional, we're happy to do that, and realize it's not the normal face of oral cancer anymore because of the discovery of the human papillomavirus being a causative agent in oral cancers.